All right, so our recording has begun, and without further ado, I'll turn it over to our presenter today.
Hello, good afternoon. I'm Dr. Nalaka Gooneratne. I'm an associate professor here at the University of Pennsylvania, and I'm delighted to speak with you today about the gift of sleep and to provide you with some background information about sleep disorders and a couple of strategies that can be helpful to improve sleep. Megan, I just want to double check. Can you hear me okay?
Everything sounds great.
Okay, wonderful. Great. So thanks for joining us today. And I thought it might be fun to begin with a question for the audience to ask if perhaps you could share what you might have tried to help you with your sleep. Some people have tried things like exercise and yoga and melatonin and so on. And to do this, fun little exercise, if you could go to your smartphone and go to your text, your SMS, your text message feature, and just type in the phone number 22333 on your text message for your smartphone. And when you type in that number, just type in the message Nalaka as the text that you send. And once you've sent that message to the number 22333, that will allow you to vote or to type in your answer on this poll. For those of you who are working from your computer, you can also go to a web page. You can go to the web page shown here, pollev.com/Nalaka. And there you can type in the names of anything you might have tried. And this will be helpful for me because if some of you have tried melatonin or if some of you have tried yoga, then I can discuss that a little bit more in the presentation. Okay, so we've had one person who's tried melatonin. That's awesome. And if anyone else would like to try typing in a couple of things, great. Someone has tried meditation. That's neat. Thank you. So all you have to do is just go to your text message on your smartphone and type in 22333 and type in the name Nalaka, and then that'll take you to the voting option. Then you can type in things you've tried to help you with your sleep. And we'll wait for another 60 seconds for people to vote. Thanks. Well, this is a lot of fun. You guys are doing a great job. We'll give it another 10 more seconds. This is awesome. All right, awesome. Well, thanks for sharing your perspectives about the different things that you've tried to help you with your sleep. And this is really interesting to see. It looks like a lot of people have tried melatonin and meditation and breathing type strategies to help with sleep. Some people have tried things like chamomile, sleep hygiene appears, that's very healthy as well. Prayer can be a good strategy. I noticed someone mentioned coffee. That's interesting. One doesn't normally think of coffee and sleep, but maybe that works for some folks. Everybody's unique. That's great. So thanks for taking a moment to share some of the things you try. And I see some people have also mentioned things like newscast and NPR. I'm sure NPR will be happy to see that. Great. That's wonderful. Thanks for sharing that. The other thing I'd like to ask is to help this presentation be one that is helpful for all of you. I'd like to get a sense of how much sleep problems are bothering you individually. And for this, again, it's the same SMS system, so you can just type in A, B, C, D, or E. So A means a lot, and E means not at all. So just type in a single letter if you don't mind, letting me know, whether you're having any challenges with sleep, and that'll also help me a little bit in terms of guiding the discussion for today. And we'll wait for about 60 seconds for this also. Thanks. All right, great. Well, thank you for taking a moment to fill that out as well. And what we see is that there are some people who have a lot of problems with their sleep, but for most of the audience, it's kind of in the often or moderate or sometimes range. So that's great. It sounds like this talk will be of some benefit to you because we'll be talking about sleep. I'm sorry that you are having these problems around sleep. Unfortunately, it is a common problem for many people, but hopefully what we'll be discussing today will be of some use for you or benefit. I'm going to now try to see if I can do a little bit of technical wizardry here and switch to the presentation itself. Let me just turn to Megan again, and Megan, and ask whether you're seeing the Prezi slides now.
Yep, all good.
Okay, wonderful. All right, thank you. So with that, we'll continue. So today's discussion is going to be about the gift of sleep, and we'll be talking about normal and abnormal sleep patterns as we get older. And as I mentioned before, by way of background, I'm an associate professor here at the University of Pennsylvania, and I'm a board certified sleep disorders medicine physician, and I also work in the geriatrics division. I'm very fortunate to work with our outstanding colleagues at the Penn Memory Center, Drs. Wall, Karlowish, and others who are involved with the Penn Memory Center. They do a great job with the different programs they're running, as well as other members of the team. And I also am involved with education, and my clinical practice focuses a lot on sleep disorders in older adults. I've been here at the University of Pennsylvania for about 20 years, and I've been doing a focus in this area for about the past 15 to 20 years. So I'd like to begin with an interesting fact, which is life expectancy, which is the growing and expanding life expectancy of our older adult population. So many people might have recollections of, when they were children, how there were some people who were in their 70s and 80s, but what we're seeing now in modern times is more and more people are living longer and longer. And this is a graph which shows how life expectancy has been increasing over the years, such that around the 2020 year, the average life expectancy is expected to be almost 90 years. So that's really an impressive statistic, and it's really a testament to modern science and the potential of healthy living, for example. With that increased lifespan, though, there are a lot of changes that occur in our body, and we're going to be discussing some of the changes that occur with sleep. One important question to ask is, how has our sleep changed as we become older? And to better understand this, we would want to think about a normal sleep pattern, and what is a normal sleep pattern. I would like to mention, by the way, that we encourage questions from the audience. So as I am speaking, if you have any questions, feel free to send a message through the chat to ask your question, and Megan will either interrupt me or will send that message on to me, and I will pause and try to answer your question. It's helpful if you ask your questions while I'm speaking, because your question might be about one of the slides, and it'll be easy for me to go back to that slide. Whereas if we wait till the very end, sometimes it can be hard to find a slide that I showed 30 slides ago to discuss something. So feel free to ask your questions while I'm speaking through the chat, and then we can ask them. I think that makes the presentation more interesting for you, and it's also more fun for me as well to hear what you're thinking and what you're curious about. Okay, so please ask questions.
We do have one question that just came in, and it was, please define normal.
Yeah, and so let's take a moment to go over that. That's a great question. It's a good segue. So this is a slide which shows a typical sleep pattern, and the slide here shows wake, which is shown with the word wake, of course. Megan, if I could just ask, do you see the pointer on the screen as I'm moving it?
Yes.
Okay, great. The letter R means REM sleep. That's also referred to as dream sleep. N1 and N2 and N3 refer to different stages of sleep, with N3 being slow wave, or what tends to be referred to as deeper sleep. And this is an example of normal sleep. So when someone first gets into bed, perhaps around 11 o'clock, they might be awake for up to half an hour. It's normal to be awake for half an hour before you fall asleep. Then they might go into the first stage, the second stage, and then eventually maybe before midnight, they might go into the deeper sleep, and that's shown by the green. And then they would be in deep sleep for about 10 or 15 minutes, and then they will start to come up, and they might have a brief dream, and they might actually have a brief awakening, and then the cycle repeats itself. So what you can see here is that this cycle happens 3 to 5 times a night. So that's an important take-home message, that sleep is not one solid activity, but it's actually 3 to 5 cycles during the course of a night. And the other important thing is that it's common to wake up after each of the 3 to 5 cycles. So it's actually fairly normal to wake up 3 to 5 times a night. And that kind of makes sense, actually, because when you think about it, human beings have been around for 500,000 years, or maybe even longer than that. However, we've only had houses and safety for maybe the past 1,000 or 2,000 years. And prior to that, 100,000 years ago, 200,000 years ago, people were living out in the open, and sleeping was more dangerous. So you can imagine that Mother Nature has programmed us to wake up naturally every 2 hours so that we can check on our surroundings. This was programmed into humans 200,000 years ago, 300,000 years ago. We wake up for a few minutes to check on our surroundings, to check on the fire, to make sure that the animals haven't wandered away, etc. These are problems that humans faced 200,000 years ago, for example. So it helped people to survive because they were waking up frequently during the middle of the night. Then what's happened in the past 100 years or so is that electricity was invented, and now people can sleep in safety and they can stay up later. And because of that, we have this false assumption that you're supposed to sleep all through the night. But the reality is that Mother Nature designed us to wake up 3 to 5 times a night naturally. So I often mention that to my patients because I want them to understand that waking up at night is actually normal. Many of my patients reply that they didn't wake up when they were younger, but the part of the reason for that is because they might have been sleep deprived when they were younger. They might have been busy juggling a family and work, and they just weren't getting as much sleep as they should. And because they were sleep deprived and tired, they were having shorter awakenings at night, and they didn't remember the awakenings. But now, fortunately, many of you might be retired and you have more flexibility with your sleep and you can get more sleep. And then Mother Nature's natural pattern emerges. So that's one important thing to keep in mind about normal sleep. It's normal to wake up 3 to 5 times a night. The second thing about normal sleep is that sleep is divided into 2 halves, the first half of the night and the second half of the night. And you can see that here on this slide, the first half of the night and the second half of the night. And the first half of the night is often referred to as deep sleep, the deep sleep period, the more refreshing sleep. And the second half of the night is naturally the more unrefreshing period. And the reason for that is because you have gotten a lot of the sleep you need in the first half of the night. You might have had the experience of putting gas in the gas tank, and as the gas tank is almost full, the gas pump clicks, and then you have to press it again, and it clicks, and you have to press it again, and it clicks. So what's happening there is that's kind of the second half of the night, where even though you want to sleep, you've filled up your sleep gas tank, so you might not need as much sleep, and that's why the gas pump is clicking, and you're not able to sleep as well. And we can see that here on this graph, where there's more deep sleep in the first half of the night, but in the second half of the night, there's less deep sleep, and there's more REM, and there tends to be more awakening as well in the second half of the night. So I just want to reassure you that it's actually natural. It's natural for your sleep to have a first sleep, which is 3 to 5 hours, and you sleep a bit deeper. Then you have a period of waking up. Typically, people are awake for 30 minutes to 60 minutes. So it's natural to be awake for 30 to 60 minutes in the middle of the night. And again, Mother Nature programmed us that way. And then they have a second sleep, or unrefreshing sleep, or morning sleep, which is typically about 2 to 3 hours, maybe from 4 o'clock to 7 o'clock in the morning, where you're kind of going in and out of sleep, and it's not as nice as the first sleep. That's how I sleep. So I'm typically awake for half an hour to an hour in the middle of the night as well. And that's perfectly fine. I don't worry about it too much. So I want to reassure you that's a natural pattern. And a lot of the times we have problems is because we want things to be unnatural. We want to be asleep like a log. But like I said, Mother Nature hasn't designed us to be that way. And that's where we run into problems, because patients take drugs in order to sleep like a log, to have artificial sleep. But the paradox, the problem, is that the drugs create unnatural sleep, and the unnatural sleep is fake sleep. So it's not as restful as the natural sleep. So as long as we can stay relaxed and not be too anxious when we wake up in the middle of the night, then we can hopefully drift back into natural sleep and fall asleep again. I understand there's another question. Megan, do you want to ask the next question?
Yes, so we had 2 questions come in. I'll tell you the first one, which is, what defines quality sleep if waking during the night is natural?
The kind of the best definition of quality sleep is how you feel during the day. So if you get 5 hours of sleep at night and you feel fine during the day, that's you 5 hours. You're one of those lucky people who needs 5 hours of sleep. If you feel a bit tired though, and you're drifting off to sleep at church or something like that, then maybe you need a bit more sleep than 5 hours of sleep, and maybe you need 6 or 7. Everybody's different. I get about 6.5 hours of sleep, for example. That's what I need, and I don't feel sleepy during the day. But there are other people who need 7.5 hours, etc. One benefit of getting older is that you need less sleep. And most older adults need about 6 to 6.5, maybe 7 hours of sleep. One of the problems that many of my patients have is that they think they should be getting 8 hours of sleep or 9 hours of sleep, or they might recall that they had a grandmother who slept for 9 hours at night or something. So they think they need 9 hours of sleep. But if you only need 7 hours of sleep and you're trying to force yourself to have 9 hours, you can do the math. You're guaranteed to spend 2 hours awake lying in bed thinking that you have insomnia. You don't have insomnia. You just don't need as much sleep as you used to. So the answer is to kind of see how tired you feel during the day. Now, I do want to point out that it is also natural to feel tired in the afternoon. It is natural to feel tired after a meal. That's why in Spain and Italy and in Mexico and in a lot of cultures, they have an afternoon siesta. It's natural to feel tired in the afternoon. So it's perfectly fine to sleep for 5 hours at night and then maybe take an hour afternoon nap after lunch. And now you're getting about 6 hours of sleep, and that might be all you need. And if you're functioning fine and you're able to stay awake during the day and you feel good, that's perfect for you. Everybody has their own sleep need, and you just need to experiment and see what's right for you. And the nice thing is you can try that out. You can play around with it for a week and try to sleep more one week and see how you feel. Try to sleep less the next week and see how you feel. I used to think that I needed 7.5 hours of sleep, but I've been sleeping 6.5 hours and I'm fine. So maybe all I need is 6.5 hours of sleep. Everybody's a little bit different. The other important point is that your sleep need changes. So if you exercise, you need about half an hour to an hour more of sleep. So that's one thing to keep in mind. A useful tool to help you figure out how you're sleeping is a Fitbit or another kind of smartwatch like an Apple Watch. And you can wear them at night and they can record how much you're sleeping. And when you start doing that, you're going to see that you wake up 5 to 7 times a night. Because the device will show that. I wake up about 5 times a night, for example, and that's great. I don't mind that at all, and that's natural. And so, and I just relax, and I'm able to fall asleep again in 20 to 30 minutes. Megan, you had another question?
Yes. So then the next question, and this is all the questions we have at this time, is should we try and stay in bed for a half hour to go back to sleep or to not get out of bed?
Yeah, so that's a good question. And I think what I typically recommend is to help you go back to sleep. I recommend that you, if you're having trouble going back to sleep, that you begin with a gratitude practice. So I recommend that while you're lying in bed, if you start to feel a little bit frustrated that you can't fall asleep, that you try to reflect on something you're grateful for. Gratitude, grateful, something that you're grateful for. You could be grateful for your grandkids. You could be grateful for your spouse. You could be grateful for the fact that you have a pension helping you with your retirement. Whatever you're grateful about. So you want, and it's also nice if you can weave in reflecting on something good that you did that day. Maybe you called up a friend and you helped them out or something like that. So this gratitude or self-compassion practice is a useful thing to do while you're lying awake in bed because it's a good use of your time. It's always good to reflect on something positive you've done. And then it also helps you to relax. And when you are feeling grateful, you are flooding your body with relaxing hormones. You're relaxing your mind. And by doing that, with a little bit of luck, you'll be able to fall back asleep again pretty quickly. And that's a much healthier approach than being anxious or worried in the middle of the night, because that will take you away from sleep. And I'd like you to do that gratitude practice for 5 or 10 minutes. I really want you to do it for a long time. I don't want you to just say, I gave a friend a phone call and then start worrying about your taxes. I want you to really spend 5 or 10 minutes. 5 or 10 minutes is a long time. Spend 5 or 10 minutes thinking about how you help someone. And that'll help you feel good, and that'll help you to relax, and that'll help you to fall asleep. However, if that doesn't work, and about half the time it might not work, if that doesn't work, then you should get out of bed for 5 or 10 minutes and just walk around the bedroom. Don't turn on the smartphone, don't turn on the TV, don't turn on the email, don't go to Facebook, nothing electronic allowed. And then just walk in the bedroom for a few minutes or sit in the chair for a few minutes. And then if you yawn or feel a little bit sleepy, then get back in bed. I have patients who are religious, and they might like to use this time to say the Lord's Psalm, or maybe a Jewish prayer, or a Muslim prayer, or a Buddhist prayer, or something religious. That's also a good thing to do with that time. And then get back in bed, and you can start the gratitude practice again to help you drift off to sleep. So that's a good question. Thank you for asking that. Now, what happens as we get older with our sleep? Well, this is an interesting graph, which just simply shows the point that I mentioned earlier, which is that we need less sleep as we get older. This, this third line right here is actual sleep. And what you see here is that as we get older, we need less and less sleep. So when we're young adults, we might need around 450 to 500 minutes of sleep. That's almost like 8 to 9 hours of sleep. But that as we get older and hit like 65 or 75, we might only need about 6 to 7 hours of sleep, for example. And we tend to be awake more in the middle of the night, which is frustrating. But like I said, just remind yourself that this is natural, and that you can put the time to good use by doing a gratitude practice or turning to your religious practice. And you can build up some credit with the higher power by using that time in bed to do your prayers or something positive. So those are some strategies that you can help to deal with the natural changes that take place as we get older. And hopefully by doing those things, you can stay away from dangerous medications like Benadryl or Ambien, etc., that can be addictive and can cause problems for sleep. The goal is to try to do things naturally, if at all possible. I was happy to see that many of you use melatonin. Melatonin is a natural product and is a good option to consider. And you can take melatonin even in the middle of the night. So, if you woke up and you were awake for a little bit and you couldn't go back to sleep, you can take a melatonin lozenge and then get back in bed. You can take any dose of melatonin. Anything less than 5 milligrams is reasonably safe. It's quite safe. A lozenge is better, and that might help you go back to sleep and avoid some of the dangerous drugs that you see all the advertisements for on TV. So that's a helpful strategy. In addition, many of you are caregivers for others who have trouble with their sleep and might have Alzheimer's or cognitive problems, and I can imagine that you don't want to take a strong sleeping pill because you might sleep through some kind of crisis that might occur. And that's why something like melatonin, which is a more gentle and natural product, might be a better choice. Now, for those of you who are, and we have a couple of slides later on about trying to improve sleep for a loved one who might have cognitive problems. This slide here shows the recommended sleep duration. And what we can see here is that for most older adults, 7 to 8 hours is a typical window, but you can see that it may be appropriate to get even 5.5 hours of sleep, for example. And so less than 5 hours might be appropriate. Less than 6 hours might be appropriate in some cases. So I just want to reassure you that there's a bit of a spectrum in regards to sleep in that regard. So what are some things that you can do to help improve your sleep? Like we mentioned, you probably need less sleep now as you're older than you did when you were younger. And if you can't fall asleep, like I said, you can try a gratitude practice, and then if that's still not working, you can get out of bed and stretch a little bit or walk around a little bit, and then maybe take a melatonin and then go back to bed. Another strategy you can do is you can try to calculate how much time you are actually sleeping, and then you can reduce the amount of time you spend in bed to more closely match how much time you're sleeping. So if you're only sleeping for 6 hours, it doesn't make sense to go to bed at 10 o'clock and wake up at 8 o'clock. That's spending 10 hours in bed. If you're only sleeping for 6 hours, why are you spending 10 hours in bed? So you might want to go to bed at midnight and get up at 7. And now that's 7 hours in bed. And those 7 hours in bed more closely matches the 6 hours that you might actually be needing or getting. So you'll have less time lying awake in bed. So that's another trick, adjusting how much time you spend in bed. So that's a discussion about insomnia and how insomnia can be a common problem. Now, one thing to talk about is how do we handle sleep if we have a loved one who might be getting up in the middle of the night and not being able to fall asleep. And there's a couple of important pieces of advice about that. The first piece of advice is exercise can help them with their sleep. So going for a walk in the afternoon can often make them more sleepy at night, and they might sleep for half an hour or an hour longer at night because they went for a walk with you in the afternoon. Walking is also very good for cognitive function, and exercise is really one of the best things we can do to delay cognitive decline. I've made it a personal goal myself to try to exercise 3 times a week because there's so much evidence showing that exercise is good to delay cognitive decline. The other thing that can be helpful is if someone is awake at night to limit the naps they take during the day, maybe to limit naps to half an hour or 15 or 20 minutes if they have to take a nap. I know this is hard to do, but it can be very helpful. And the reason for that, again, is, if somebody needs 7 hours of sleep in a 24-hour day and they're taking a 2-hour nap, they only need 5 hours of sleep at night. So they might only need to sleep from 1 o'clock at night to 6 o'clock in the morning. That's 5 hours of sleep, 1 o'clock to 6 o'clock, because they took that 2-hour nap in the afternoon. And I know that can be challenging because sometimes patients go to daycare centers or they have daytime assistants. And frankly, the daycare centers or the daytime assistants are typically quite happy if the patient takes a 2-hour nap in the middle of the day. But unfortunately, that'll make things worse at night. So you might want to just encourage the daycare staff or the daytime assistant to try to limit the naps to 20 minutes or 30 minutes. That tends to be a little bit less disruptive in terms of nighttime sleep, a shorter nap. Or if you want them to keep taking an afternoon nap, that's perfectly fine, but then they should go to bed later. It doesn't make any sense to take a 2-hour nap from like 1 o'clock to 3 o'clock in the afternoon and then try to ask our loved one to go to bed at 7 p.m. right after dinner and expect that they're going to sleep from 7 p.m. till 9 a.m. That's like, 10 hours in bed plus a 2-hour nap. That's 12 hours in bed. Nobody needs to sleep for 12 hours. So they're going to be awake for a couple hours in the middle of the night because they can't sleep for 12 hours. So you might need to adjust the amount of time that they spend in bed at night if you want them to keep taking a nap in the afternoon. So that's the important thing to think about, that sleep is a little bit like gas in the gas tank. If your gas tank can hold 7 gallons of gas, you can't put 9 gallons into the 7-gallon gas tank. So just keep that in mind as you're thinking about the sleep schedule for yourself or for someone you're taking care of. Then other options to help with sleep, if that doesn't work for someone that you're taking care of, you could discuss with your doctor about melatonin. You could discuss with your doctor about something like trazodone that might be helpful for sleep as well. So that's an overview of sleep, of insomnia. And we will next switch to the topic of sleep apnea. So sleep apnea is a condition which is characterized by abnormal breathing during sleep, and it occurs when we pause our breathing for more than 10 seconds while we're sleeping. So we typically take a breath every 6 to 8 seconds, but if we're having sleep apnea, we don't breathe for more than 10 seconds. And that's not healthy because when we don't breathe, we don't send oxygen to the brain. And if the brain doesn't get oxygen, that can interfere with our brain function, and that can cause the neurons in our brain to die or to be damaged. And when the neurons in our brain die or are damaged, sadly, that can lead to problems like dementia. So there's a possibility that sleep apnea, there's a chance that sleep apnea may increase the risk of cognitive decline if it's left untreated for decades. Now, what causes sleep apnea? Unfortunately, it's just a design flaw of the human body. And what happens is that the tongue, as you can see in this picture, the tongue here falls back. And when the tongue falls back, it closes off the windpipe, which is shown in this circle area. This is the windpipe back here. And as you can see, the windpipe is pretty narrow. The windpipe is the size of a pen. So just imagine a pen. That's the straw through which you breathe. And when we go to sleep, that can get closed off. It can get pinched off by the tongue. And then when that happens, we don't breathe. And if we don't breathe, we don't get oxygen to our brain. And then that can damage neurons. So that's sleep apnea. And unfortunately, as we get older, we are more likely to get sleep apnea. So this is a graph which shows the percent of people who have sleep apnea. And on the x-axis, we show age. So around the age of 65 to 75, about 1 in 4 to 1 in 5 people have sleep apnea. And it could be that people who have dementia or cognitive impairment might have even higher rates of sleep apnea. And it might be that even 30% of these individuals who have cognitive impairment might have sleep apnea. The symptoms of sleep apnea are snoring. Also, being very sleepy during the day can be a symptom of sleep apnea because you're not able to sleep well at night. And another symptom of sleep apnea is if somebody witnesses or sees that you stop breathing at night. That can also be a clue. So you might have had that experience where your partner is snoring and then suddenly the snoring stops and you're thinking to yourself, they've stopped snoring, but then it starts back up again. So what happened is that they actually stopped breathing during that pause. And if that's more than 10 seconds, that might be sleep apnea, and that might lead to a slight drop in oxygen level. And maybe it's worth discussing whether they should get a sleep study to look for sleep apnea and consider getting the sleep apnea treated. And the reason for this is because there is some possibility that we don't have proof yet, but there's some suggestion that if we treat the sleep apnea, we might delay memory decline, but we don't have proof yet. So it's just a theory at this point. And we're doing research studies to see whether this is true or not. So maybe we'll have an answer in a few years. But if there is a big problem where someone you know is having a lot of trouble with loud snoring and other problems, then it might be worthwhile to consider a sleep study independent of the memory issues, because we don't yet have proof that sleep apnea is linked to memory problems. There is also some suggestion, but again, we don't have proof yet, that people who have sleep apnea might have more trouble when they go in the hospital, and then they might be at greater risk for getting delirium. Now, how do we treat sleep apnea? Well, generally we treat sleep apnea through a combination of things like weight loss. Trying to sleep on your side is called positional therapy. And then for some people, we use something called a CPAP machine, which is a small mask that the patients wear when they go to sleep at night. And then the mask helps to keep the windpipe open while the patient is sleeping. And by keeping the windpipe open, they're able to breathe normally. Sometimes it can be hard to wear a CPAP mask. So there are also special mouthpieces that you can wear that will help to keep the windpipe open as well. And these are things that might help to reduce sleep apnea. In some cases, we might even consider oxygen therapy, but we don't use it too often. But sometimes we use oxygen therapy. So those are some examples of how we might treat sleep apnea if someone has sleep apnea. Great. So now we're going to just pause for a moment. And in case anybody has any questions about sleep apnea, I'll wait for about 10 seconds. And then we'll move on a bit more to the topic of insomnia.
So there's a question that was just put in specifically about sleep in the realm of sleep apnea, saying, I wake up because of dry mouth. Is that kind of associated? And is there anything that I can do to maybe remedy that?
Yeah, dry mouth can occur because of sleep apnea, because the abnormal breathing pattern sometimes leads to dry mouth. So it might be worthwhile to consider getting checked for sleep apnea in that case. Many older adults, about 30% of older adults, sleep alone, sleep in their own bedroom. Actually, people typically sleep better when they sleep alone because the bed partner is not disturbing them. It's actually a good tip for healthy sleep. But if you are sleeping alone and you don't know whether you have sleep apnea, one thing you can do is when you visit people, if you visit family or you visit friends, you can ask them, by the way, did I snore last night? And if they say, yes, you were snoring, there's a good chance you're snoring when you're not visiting them as well. And occasionally I hear funny stories from my patients how they tell me they don't snore, but yeah, when they were visiting their grandkids, they were asked to sleep in the basement because they snored so loudly. So they're probably snoring at home too. So it's helpful to ask, when you go on a trip, if your church group goes to, on a trip somewhere, or if you're traveling with some friends, you can ask them, by the way, did I snore? And so getting tested for sleep apnea can be useful. You can also talk to your dentist. Sometimes dentists have a list of options that can be used to help with dry mouth. Dry mouth is unfortunately more common as we get older, and it could be due to a variety of causes, not just sleep apnea. Okay, we'll move on now to insomnia. And one of the important things I want to mention about insomnia is that sometimes we make some bad choices that makes our insomnia a little bit worse. And one of the main things I see happening with my older adult patients is because they're fortunate enough to be retired, they sometimes sleep in the mornings. So they might have a bad night of sleep that night, and they might just sort of say to themselves, I think I'll get up at 9 o'clock. I don't think Megan does that if she has a bad night of sleep because she's got to show up for work. And so when you have, a job and you've got to be there at 8 o'clock, you have to get yourself out of bed at 7 to show up for work. On the other hand, if you don't have a commitment, you can just sort of say to yourself, yeah, I don't think I slept well. I'm going to sleep until 9 o'clock or 10 o'clock. But that's not a good idea. It's not a good idea because you are confusing your brain. So when you wake up later, your brain starts to get out of rhythm, and your brain doesn't know when to wake up naturally because you're waking up at random times. It turns out that all of us have an alarm clock in our brain. It's a hidden feature you never knew existed. So you have an alarm clock in your brain, and that alarm clock sets itself by watching what you do. So if you wake up at 7 o'clock one day and you wake up at 9:30 the next day because you stayed up late watching something on TV, and now you kind of want to sleep in until 9:30, the alarm clock in your brain starts to get confused. Do I go off at 7 o'clock? Do I go off at 9:30? What do I do? And when the alarm clock in your brain gets confused, that is how insomnia can get worse, because now you don't know when to fall asleep. Your brain doesn't know when to fall asleep. So if you go to bed at 2 o'clock for a couple of nights and then you want to go to bed at like 11 o'clock, your brain is confused and you might lie in bed for an hour or two. And now you might be thinking you're getting insomnia. Well, maybe not. Maybe you just need to have a more regular sleep pattern. Unfortunately, a lot of my patients have a really hard time with that because they feel miserable if they don't get enough sleep the prior night. But it's a bit like, trying to lose weight, but then grabbing a cookie from the cookie jar whenever you have the munchies. You know, you don't need to go to medical school to know that grabbing 3 or 4 cookies from the cookie jar is not going to help you lose weight. So in a similar way, just trying to stick to a regular schedule in terms of when you wake up will help a lot with insomnia. And there's been some interesting research which shows that older adults are more at risk of going to bed late or waking up late, and that messes up their internal alarm clock. So in this research study, the stars represent younger adults and the circles represent older adults. And this shows different times of when they went to bed. And you can see that a lot of the stars, this is like a kind of a circadian clock here. And basically what it shows is that a lot of the younger people tended to go to sleep around the same time. They're not going to bed at 2 o'clock, but this is adjusted for circadian time. But they're going to bed kind of in a tight time window, whereas the older adults are kind of doing a lot of different things, with some of them, going to bed at wildly different times. And that unfortunately can cause insomnia to get worse. So that's one helpful tip to keep in mind. In addition, some of us have loved ones who are in nursing homes, and sometimes the nursing home can be noisy. Sometimes the staff in the nursing home make a lot of noise, and that can wake people up, unfortunately, as well. Now, in terms of evaluating your insomnia, like I said, some of these new devices like a Fitbit are really interesting and helpful because they can be useful to help with diagnose and evaluate your sleep. Now, if that relaxation approach that I discussed with you earlier isn't helping you, and if having a regular sleep schedule isn't helping, and if exercise is not helping, then you might need to see a therapist to get more help for your insomnia. And in this regard, we typically recommend that you do cognitive behavioral therapy for insomnia. So when you talk to your doctor about getting help with your sleep, you want to ask the therapist, are you trained in cognitive behavioral therapy for insomnia? And maybe they'll say yes, maybe they'll say no. A lot of therapists are trained in cognitive behavioral therapy, but they might not know cognitive behavioral therapy for insomnia. There's cognitive behavioral therapy for depression. There's cognitive behavioral therapy for anxiety. There's cognitive behavioral therapy for PTSD. And there's a different kind of cognitive behavioral therapy for insomnia. So you'd want to see a specialist who is trained in cognitive behavioral therapy for insomnia. The Penn Sleep Center has several therapists trained in that. The Mainline Health at Lankenau has several therapists. Jefferson has a lot of good therapists, et cetera. So many health systems have therapists, but just make sure you're getting a therapist who's trained in cognitive behavioral therapy for insomnia. And you should do that before you start taking any kind of sleeping pill, including things like Tylenol PM or Unisom or Benadryl or ZQuil. Those kind of pills are sleeping pills in a way, and you'd want to try behavioral approaches first. I see there's a question. Megan, do you have a question?
Yes. So there was a question about breathing through your nose and importance of that potentially while we're sleeping. Is that something that you recommend, or could you speak on that a little bit?
Sure. I think breathing through your nose can be helpful. The nose is how Mother Nature designed us to breathe. The nose humidifies the air, and that's why we're supposed to breathe through our nose. Many of my patients tell me that one of their nostrils closes when they sleep at night, and they're absolutely right. That's also natural. Mother Nature has designed us that one of our nostrils closes at night, and Mother Nature has designed our nostrils so that one nostril closes for about half an hour, and then the other one will close for half an hour, and then it will alternate. Again, another feature that your body had that you didn't know about. So this happens because Mother Nature is giving each nostril a rest so it can get ready to go back on duty again in half an hour. So you might notice that your right nostril closes, and then after half an hour, it'll be your left nostril, but you probably have fallen asleep by then. So you don't, so you might think that your right nostril is always closing when you go to sleep, but it's just a natural alternation process. Typically the nostril that's lying down is the one that's more likely to close because gravity pulls fluid down, and then the nostril naturally kind of closes, and the nostril that's higher will open up. So it's pretty natural for that to happen. So don't be upset if one nostril is closing. And you can test that theory out by lying on the other side for half an hour and seeing what happens. Not everybody does it, but that's a pretty common pattern. And it cycles at different rates. For some people, it's every hour. For some people, it's every 15 minutes. For some people, it's every 2 hours. It varies. But breathing through your nose is typically the natural way to breathe. If you breathe through your mouth, you're more likely to get dry mouth. Okay. Like
We
I said,
actually have one more question
sure.
that just came in. So is it advantages or disadvantages between sleeping on your back side, or I think they said front on their stomach would be my assumption.
Yeah, so typically sleeping on your back is the worst because gravity will pull your tongue back and close off your windpipe. Remember, your windpipe is the size of a straw, so it's pretty easy for the tongue to flop back and close it off. And then you're not breathing normally. So, and many of you probably have had that personal experience where your bed partner is snoring, and hopefully the kinder ones, the kinder people amongst you will gently whisper, "Honey, can you roll over onto your side?" And the less kind ones might give a nudge or a slap. But in general, you might gently nudge your partner and encourage your partner to sleep on their side, and that will be a way that we encourage people to breathe more healthily by sleeping on their side. Sleeping on your stomach might also help with it a little bit because you might be a little bit less likely to have your tongue closed off, but you are oftentimes twisting your neck to the side when you sleep on your stomach. So sleeping on your side is typically the healthiest posture for sleeping. Great. I know we're coming up to 1:55, and the best talk is a talk that ends a few minutes early, so we don't drag you out a little bit too long. But I would like to pause for 10 seconds to ask if anyone has any other questions.
There was a question about any aids to kind of help keep someone on their side.
Yeah, that's a good question. So one helpful trick is a backpack. So you might have a backpack lying around the house. Just grab a small pillow and put it inside the backpack, and then gently ask your loved one to wear the backpack when they go to sleep. And as you can imagine, it's hard to sleep on your back when you're wearing a backpack. So the benefit of the backpack also is that if your partner moves around in the bed, the backpack is going to follow them because they're wearing it. So that's why the backpack will help them to sleep on their side. That's a simple trick, and you can adjust the size of the pillow. You can use a small pillow or a big pillow and see what works. You can buy a comfortable backpack. You can actually look on Amazon, and there is something called a sleep apnea backpack, and one of the companies that makes a sleep apnea backpack is a company called Woody Nose. So if you wanted to, you can look this up. I just typed it into the chat. It's kind of a funny name. I don't know why they called themselves this. I have no financial connection to this company. I probably would have asked them to have a different name if I did. But in any case, Woody Nose is the name of the company. So just type that into Amazon. Woody Nose sleep apnea backpack. It costs about $60. And it's useful because it has an inflatable pillow. So you can deflate it as much as you want or inflate it as much as you want. And it's a bit more comfortable than a regular backpack. So it's a little bit easier to wear. And because it's inflatable, you can deflate it and then put it in your suitcase and then inflate it when you get to Vienna or whatever lovely destination you have in mind. So that's another thing that you can try. But there's a couple of other products on Amazon as well. There's like a belt you can wear that has balls on it, etc., that help you to sleep on your side. So good question. Thank you for asking that. So it's about 1:58. I'd like to thank you for joining me. I hope this was of some help. Thanks for filling out that fun word salad survey. I wish you many nights of healthy sleep. Thank you.
Thank you. We want to just thank you once again for sharing your expertise with us. It's really wonderful. We did record today's lecture, and we'll be sharing it once we've polished it all up. If you have time, I do have one more question that came through the chat.